Nearly 30 million Americans, that's 1 in 7 of us, suffer from bad backs. If you have trouble, you're certainly not alone. On any given day, 6.5 million people are in bed with lower back problems. The problem is sciatica. With me tonight is Dr. Stephen J. Press, an expert on sports injuries and a member of the U.S. Olympic Society. Perhaps Dr. Press can give us some hints on alleviating back pain.
Thank you.
Being with the Olympic Society and a back expert, are you kind of saying by this association that a lot of back problems are caused by being active in sports?
No. Let me clarify the connection. I'm a chiropractic physician practicing in Englewood, and I'm associated with the Speakers Bureau of the Olympic Committee. A lot of athletes use chiropractic services because by relieving interference with the nervous system, we can help their muscles to function at a higher level, so that chiropractic is a very important part of Olympic athletic participation now.
What is this sciatica that seems to be a big problem?
Sciatic pain, sciatic neuritis, is a very severe problem. It's a problem that usually involves a severe burning pain that radiates from the lower back down through the buttock and into the leg, sometimes going as far as the toes. If left unchecked, it can lead to deterioration of the muscles in the leg. It can lead to severe burning pains and loss of use of the leg. It's a very, very serious problem, and many people suffer from it. And in fact, it's been described by some people who are some of the worst sufferers as being similar to having a red-hot burning poker run down through the back of the leg. So it's a very bad pain. The cause of this often is a so-called herniated disc. And what that means is that the shock-absorbing mechanism in the lower back, which is a piece of cartilage with a gelatinous center, has a bulge in it. And it happens that the bulge is pressing on a nerve. Now, the typical medical treatment for this has been the first line of treatment has been to provide painkillers and muscle-relaxing drugs.
Well, that doesn't solve the problem.
No, neither.
Is there a cure?
Yes, I believe there is in many cases, and that doesn't mean that anything is absolute. But drugs and painkillers are no more the cure than would be to cut off the wires to an alarm bell if your house was burning. The answer would be to find out if two bones in the spine are misaligned, if they're locked in a position in which the disc is caught in a wedge, then the disc must bulge into the open side of that wedge. And then it will, if it's bulging in that direction, pressing on a nerve, it'll be causing that pain. A simple, safe, very effective chiropractic treatment can usually alleviate that kind of a discrepancy in the spine.
I'm sure a lot of people like myself that try to be active physically to stay in good health wonder how much of what you do, jogging, exercising with weights, how much is bad for your back? You know, I'm sure with the summer people would want to know this.
Well, a lot of people will come into my office and they'll ask me, they'll say, Dr. Press, what should I do to help to keep my spine in good condition, and how is my sport affecting my spine? And the answer is usually this: exercise generally is very good for you. However, if your body is not structurally balanced, if, for instance, one leg functions a little shorter than the other because one ankle may turn in too much, then your weight won't be evenly distributed, and the stresses of your athletic performance won't be evenly distributed on your legs, and you'll have problems from that.
So generally then, what percentage of people with back problems, what percentage is hereditary, what problems are they born with versus self-induced ones?
Well, you're asking some very astute questions. The hereditary aspect is a very important one, and certain ethnic groups, for instance, are predisposed to, I think, to back problems because of a predisposition to having the ankle ligaments being weak. The one foot rolls in more than the other. This causes one leg to function shorter.
What ethnic groups? I'm curious.
Jewish people, Italians,
really?
Black people, anyone with African descent, Greeks, anyone from the Mediterranean region.
Why?
If I could answer that, that's the $64,000 question. But this has been my experience from an empirical basis. I don't know that there have been any significant studies that would prove that, but that's been my observation.
Why in the last, I don't know, 5 years, 10 years, whatever, all the talk about chiropractors? You're young, you got into that line. Why does this seem to be so new?
Well, I think people are recognizing the fact that people are starting to learn about the fact that the chiropractic profession is a modern scientific process. The education is now fully accredited, and people are becoming aware of the fact that our educational process is 5 academic years after college. It's not 6 months in the back of a health food store like some people have thought.
So you people are trained in strictly care of the back?
Well, no, we're trained to diagnose and treat human disease. Chiropractors treat not just back problems and back pain, but things like menstrual cramps, migraine headaches, and bronchial asthma. Some of those things do respond very well under chiropractic care.
Okay.
It's not a panacea, but it can help many people.
Well, we'll have to have you back to talk about some more of those at a later date.
Well, thank you.
Thank you for being with us, Dr. Press.
You're very welcome.